We're looking at ridge relationship. And so according, the marks look pretty good. There's a chance here that in the first premolar region you might be ever so slightly buccal to the mark, okay? Because this is about where the central grooves line up, and this is where the mark is, okay? And consequently, what's happening, and the same is true for this side as well, because the arch former in the anteriors was a little wide, that's going to force the premolars out to be a little bit buccal as well. And so if we tuck that in ever so slightly and then correct this, then we'll be right on top of the ridge, okay? But overall, the ridge position is good. We lose some points up here for the ridge relationship here. So let's say 8 out of 10 on either side. Okay? Now, the occlusal plane. What we're looking at with the occlusal plane is a couple things: the symmetry, the position in terms of the height, the question of whether the curve of Wilson is progressive and smooth, as well as the curve of speed. And this one looks pretty good. What we're going to look at here is we're going to look at the occlusal plane height. We want to make sure that the first 3 cusp tips in the mandibular arch on the first premolar, second premolar, and the mesial buccal of the first molar are in line with the mark, and they are. They look very good. And that another telltale clue is if this tooth is too high or too low in relation to the retromolar pad. Okay? We want it above your halfway point, but we don't want it too far above the top of the retromolar pad, and that looks good. In terms of curve of Wilson, we could take a look here, and the curve of Wilson on the lower arch looks good, and the corresponding curve of Wilson on the maxillary arch looks pretty good as well. So I would say, in terms of occlusal plane, this is very well done. So we'll give it a 10 out of 10. Now, centric is something that is very easy to determine. One of the things that we're doing is we're just basically counting up contacts, and in order to do that, we have to make sure that the opposing marginal ridge, the marginal ridges that oppose the functional cusp tips, are in line and at the same height buccal lingually as well as occlusal gingivally. And you can see here that the horizontal overlap is pretty good. We're just going to count up the points here: 1, 2, 3, 4, 5, 6, 7, we're missing the distal here, 8, 9. This one's a little questionable, but it's pretty good. So I would say 10 out of 12 points. Again, a very good score on buccal centric. Lingual centric's a little bit more difficult to tell. What we do normally is we transluminate through the light here, and we're looking at the position of the cusp tip. And again, looks very good on the patient's left side, as well as on the right side. Again, basically counting up points, I would say there's probably only one discernible contact missing, and that would be on the first or second premolar. Okay, so 11 points. Again, very, very nicely done. Now, on excursions, what we're going to do is to check the excursions. On the working side, we'll lock the condyle, and we're going to open the articulator up and move it across to the point where we're edge to edge, and then gently close the articulator together to see how they interdigitate. We do not want to grind it into position, because that will give us a false sense of security. On the patient's right working, you can see that everything interdigitates very well, except we may be missing the lateral incisor. Now, sometimes the lateral incisor will be in contact, sometimes it won't be, depending on how high off the occlusal plane we have that. But I would say, for the purpose of this exercise, right working, meaning right lateral protrusion working, it's 5 points. Okay? 5 out of 5. On balancing, we just make sure that all the tooth contacts are present on the balancing side. And again, they are. We have 5 contacts there, so that's 5 points. in left working, we're going to unlock the right condyle now. Again, we're going to go across to the side here. And now we have a little bit of a problem here. Okay? You notice that there's interferences right here and right here, and we're discluding along in this area right here. And that's probably due to the position of this cusp tip being too far to the mesial in relation to the buccal groove here. Okay? And so over here we end up with the 2 points. Okay? And again, grinding it together like this, we probably would miss that, because we can make it fit if we flex the articulator enough. But coming across like that, you can see that there's a discrepancy. Now, on the balancing side, what's happened is that because of the interference on the working side, you notice how when we go edge to edge on the working side, that the balancing side is completely discluded. Okay, so this is a really good example. This is 0 points on left balancing. This is an excellent example of a good side and a poor side. Okay. Now in protrusion, what we want to do is we want to bring the articulator just so that we're edge to edge on the anterior teeth. Okay. And what we can see right here is that we have a good distribution of contacts, both anteriorly and posteriorly, okay, as well as bilaterally. That's very important. Protrusion is somewhat difficult to get every single contact, but what's important is that the contacts that we have are well distributed bilaterally for balance, and that they're well distributed anterior posteriorly. And this one has been done very well. Again, 5 points. Okay. Now, wax contour, generally what we're going to do for wax contour on the first examinations is we will automatically assign you 5 points. Okay. This one has been done quite nicely. It's nice and neat. There's no excessive wax. Neatness score is very good. Again, what we're going to look at as well in terms of neatness is whether or not there's any flash, whether the record bases are well trimmed and polished. Basically, whether or not you would feel comfortable putting this in a patient's mouth, or maybe more importantly, if you would feel comfortable putting this in your own mouth. Okay? And this one's in pretty good shape. Okay? There's certain areas that need to be contoured here in terms of festooning for future examinations, but for the purpose of the midterm examinations, this is absolutely fine. So I would say wax contour is 5, and I would actually give a neatness score of, let's say 9 points on this. This is done very well. So, how would we troubleshoot this particular area? When we look at balancing contacts being discluded, oftentimes what that means, because of the pathway that the working cusp takes on the right side, for example, or let's be specific to the left working, because the cusp follows buccolingually on the working side, okay, oftentimes if there's a major discrepancy or interference in terms of the curve of Wilson, because we're looking at it in terms of the frontal plane, that may be a problem. On the balancing side, oftentimes because the cusp pathway that it's taken is influenced both by curve of Wilson and curve of Spey, okay, we have to look at both of those things. Okay? Now, when we have disclusion on the working side, the first thing we have to do is find out if it's a single cusp tip, if it's a problem in terms of the interdigitation on the working side, which on this case it was. There were 2 teeth that were preventing the other teeth from occluding here and discluding the balancing side. So the first thing we do is we correct that interference, and that brings the teeth closer together. If the balancing side is still discluded at that point, then we need to increase the compensating curve, okay, either the curve of Wilson and or curve of Spey, depending on the case, to compensate for that, and then we'll pick up the balancing side. Much in the same way that was done on right lateral protrusion, where everything, you basically had a perfect score on that. Okay, so this is a very nice setup, and that's how we evaluate these setups.